It is no secret that vaping has become increasingly popular among high school students, despite the many attempts to make them harder for teens to get their hands on them. So parents, how do we talk to our kids about using vapes? 9 News medical expert, Dr. Payal Kohli is here to help us kickstart that conversation. Okay, Dr. Kohli, I'm so glad that we're tackling this. So number one, why is vaping such a concern for kids? And what would you say is the biggest mistake that parents are making right now?
So Sam, I want you to pay attention to this.
I know, I'm nervous.
Sophie is coming up upon it, right?
You're right, she's 9.
Yep, so around the age of 10 to 12, you want to start to have this conversation. And the biggest mistake that parents make is that they wait for the kids to start vaping before they have that conversation, because it's an uncomfortable conversation.
Right.
So it's very much like sexual health or wearing a seatbelt. You want to do it before the fact and really educate your child. But unfortunately, vaping has become an epidemic in our teens and adolescents. And if you look at recent survey data, 1 out of 10 middle or high school kids are actively using tobacco products.
1 out of 10.
1 out of 10.
That's a scary statistic.
I mean, it breaks your heart, right?
It does,
And
yeah.
it's because the vaping companies have targeted them. They look like cool little electronic gadgets. They smell good. They taste good. The nicotine is highly addictive to the adolescent brain. So when kids are developing, their brain develops up until the age of 25. And if you expose it to these types of toxic chemicals earlier, you can start to have problems with learning, memory, problems with impulse control, problems with emotional regulation that last for the rest of their life, not to mention, of course, the lung disease and damage you're causing.
Everything that you just stated is definitely chilling. We want to do everything we can to curb this. Being a cardiologist, what are some of the cardiovascular things that you are seeing in these kids or teens that are vaping?
So this really scares me, because immediately after you vape, your heart rate goes up, your blood pressure goes up, and the long-term effects can include stiffening of the blood vessels, inflammation, even clot formation.
Wow.
And we don't have a ton of data of what happens when you give young kids whose blood vessels and heart and everything else is still developing years of exposure to vaping. And so certainly I'm thinking it's going to create, this vaping epidemic is going to create a cardiovascular disease epidemic for these people much earlier in their life than it happens, as usual. Usually you get cardiovascular disease 50s, 60s, 70s. These kids might get it even earlier.
Okay, so very important for us to start the conversation, for me to start it now before they get to that age where they might be trying it or becoming addicted to it. How do we start the conversation?
Yep.
How would you recommend that we do that?
So you have to be curious. You cannot be attacking them. You cannot be punitive. You have to open it up. And the way that the guidelines really recommend doing it is, like I said, 10 to 12 when they're about to go into middle school. And you want to make sure you have it repeatedly so that it's not just a one conversation and done. It's not a lecture, but it's an ongoing discussion. And the questions to ask them is, have you heard about vaping? What do you think about vaping? Are kids at your school vaping? And, if somebody offered you a vape, what would you do? What are your thoughts on that? And so that way you can start to get their wheels turning and get them set up for that situation when they may find themselves with a vape.
And it doesn't feel preachy. Before we let you go really quickly, if someone's watching and they have this conversation with their kid and their kid says, I've tried it, what do you do then?
So the first thing you do is don't get angry, right? Because that's it. You close the door to the conversation. In fact, you ask them, why did you try it? Have you tried to quit it? And then you get their pediatrician involved. And if you don't know for sure some of the signs and symptoms that someone might be vaping: increased thirst, irritability, nosebleeds, if they smell fruity, because the vapes often smell fruity, or if you find charging devices that don't seem to make sense with the regular phone chargers. These are all signs that your kid might have a vape. But don't attack them. Open that conversation and take them to the pediatrician. Come up with a plan to get them.
Okay, very insightful. Very, very good information, Dr. Kohli. We appreciate you as always. Thank you.